Let's all be aware of the holy presence of the Lord. Let us pray. Lord, our eternal God, we are about to begin our webinar, and we do so with the awareness that without your divine presence here at the center of our activity and also within ourselves, our works will be empty. Bless the attendees, the speaker, the facilitator of this webinar, Father. Grace us with your wisdom and vision. Gift us with your holy humor and humility, so that not only with this activity, but all our lives may be a meeting place for your kingdom. This we ask in your holy name. Amen.
Amen. Thank you so much, Era. Once again, welcome to everyone for another interesting topic of our webinar this afternoon. So the title of our webinar this afternoon is how to boost our immune system, especially now nasa pandemic tayo. So we have a very special guest this afternoon, and allow me to introduce our guest speaker. He is a lifestyle medicine physician, the founding member of the Philippine College of Lifestyle Medicine. He is also the member of the Asian Society of Lifestyle Medicine, also a member of American College of Lifestyle Medicine, and member also of the Obesity Society in USA. And lastly, he is the member of the Philippine Association for the Study of Overweight and Obesity. Everyone, help me welcome our speaker for this afternoon, Dr. Paolo Dipasupil. Doc, good afternoon.
Hi, good afternoon, Irvin. Thank you for that introduction. Good afternoon sa mga taga-Jensen po sa Mindanao. The last time I was there was last year, if I'm not mistaken. Tapos last February, I was just there for a conference in Davao naman. So it's a really nice place to go. Ang dami ko ata nakain din mga fish po dyan, no? So this is a very interesting topic, no? And how to boost your immune system. I know some of you are already doing something for them to boost their immune system, to prevent any kind of diseases. Iba naman siguro nag-supplements na po, no? So, ito itatakol natin. Ano po ba yung mga pwede niyong gawin? Ano bang pwede niyong i-take na supplements too? Right? So, few housekeeping rules. Just you could place your you could mute yourself. There's a mute button over there, and then you could use the chat to post comments and questions if preferred, and then there will be a chance to ask questions after the presentation, right? So the overview of this webinar, I'll be giving you some practical strategies or yung mga tips, no, to guide you to healthier lives and boost your immune system. So isasama ko dito yung COVID-19 overview, yung mga high-risk factors for this severe illness of COVID-19, mga lifestyle plans such as nutrition, hydration, physical activity, and healthy habits. Okay? So medyo marami-rami, pero I hope you'll be able to learn a lot. Okay? So here, you know all about COVID-19. COVID-19 is also called as coronavirus disease 2019, and that is the name of the disease. Ang pangalan naman po ng virus ay severe acute respiratory syndrome coronavirus 2. So napakahaba, no? So as you can see on the image on the left side of your screen, makikita nyo, this is how the the virus looks like. And makikita nyo there's like a red spot protruding from the cell. This is how the cell or the coronavirus attaches to the cells of our lungs, no? So dyan siya dumidikit. And it looks like a crown, kaya tinawag siyang coronavirus, okay? From the word corona, okay? And there are 3 common symptoms pa rin po ng COVID-19. Fever that is 38 degrees or more. You need a thermometer for you to get this temperature at saka required na yan, and we recommend you to have thermometer at your home. Okay? Next, cough. Could be dry. It could be productive. Ang productive, ibig sabihin, may plemang ilalabas. Okay? And shortness of breathing or difficulty of breathing, ito ay isang red flag na po ng COVID-19. Lalong-lalo na kung sa tingin nyo may exposure po kayo, lumabas kayo, no? Ito, kailangan nyo na po consulta sa isang doktor, and you have, or if not, you could also call the Department of Health hotline. Okay? Headache, joint pains, sore throat, pwedeng loss of senses ng mga taste, smell, no? Pero babalik din naman po yan once na nag-recover po. Okay? So here are the yung timeline of how COVID-19 developed as a pandemic. So it all started as, on December 31, China alerted the World Health Organization of the first few cases of COVID-19. Few hours lang po yan before the new year. Next, on January 30, the Philippines declared the first case of coronavirus disease 2019, and we called the COVID-19, no? And then 1.5 months, syempre dumami ang kaso. We already started the Luzon ECQ. That was March 16. Tapos pa konti-konti, no? ECQ, ECQ until naging GCQ. And October 20, hotels are already in a full swing na baka magkaroon ng full capacity na sila. Meron din mga airlines and then mga other areas po na we're moving back to the normal operations. At saka yung curfew, there are already some areas na po na 12 a.m. to 4 or 5 a.m. na po. Okay? So, what are the high-risk factors? Alam ko meron pa ring mga tumataas ang cases pa rin po dyan, no? Sa General Santos. Now, ang number one, or the biggest risk factor, ay elderly, no? Their immune systems of older adults weaken with age. Kasama na po dito kung meron din silang mga sakit po, no? So mga example ng mga sakit na pwede magdagdag ay diabetes, no? So diabetes, kung nakita niyo po dyan, they're more likely to have health problems, and this is make it harder to overcome COVID-19. Why is it? Because yung carbohydrates, yung asukal na tinatawag natin, no? Kailangan po yun ng inyong cells para mag-function sa ating katawan. One of the functions ay para normalize or para magkaroon ng tamang immune functioning or response, lalo na kung meron pong foreign body. So kung wala po masyadong carbohydrates na pumapasok sa cell, it won't be functioning. At saka, mahihirapan mag-recover from the infection. Kasama na rin dito yung mga chronic lung disease. Example would be asthma, yung hika, no? Yung COPD from a chain smoker. This could affect or could cause some flare-ups and possibly lead to pneumonia. The third one would be heart conditions. So, ang alam niyo naman po, ang baga natin, no, magkatabi lang po sa puso. So, kung naapekto ang ating baga, ang susunod pong sistema ay yung heart, no? So, people with heart failure can lead to worsening of the COVID-19 symptoms. Ito po yung talagang hirap na hirap silang huminga po, no? Na kailangan nila ng oxygen support. Ang pang-lima po na high risk factor po ay chronic kidney disease, yung mga nagda-dialysis, ha? They are really prone to have infections because of their weakened immune system, at saka hindi sila makapagtanggal din ng maayos po ng mga waste nila, yung mga ating mga radicals. And then the sixth one would be immunocompromised and liver diseases. Example ng immunocompromised, ito po ang mga HIV, AIDS, ito po yung may cancer, mga nagki-chemotherapy, radiotherapy, at saka yung autoimmune diseases. So people with weak immune system have reduced ability to fight the infection. Okay? And then the biggest risk factor after your elderly or yung mga senior citizen group natin ay ang katabaan. So according to a senior researcher in New York, that when they're treating patients with obesity, COVID-19, obesity is the most important of the chronic conditions when they are treating them simultaneously with other conditions. Okay? So malaki po, no? Very very serious din po. Why is it serious po ang pagiging mataba o tumataas ang ating timbang, no? First, yung breathing natin, no? So kung medyo lumalaki na po tayo, lumalaki na isang tao, it would increase the risk of serious breathing problem. We call it the ARDS. No? Ito yung nakikita nyo sa mga ibang bansa noong mga March at April na parang ang lalaki po ng na-admit, no? Tapos kailangan nila ng mechanical ventilation. So ito yung would require ng oxygen support na tinatawag, no? And ito hirap din ng mga doctors how to manage them, lalo-lalo na kung meron din sila ibang sakit. So mga comorbidities po, pwede yung kanilang mga sakit sa puso, yung diabetes, fatty liver diseases. It may somehow affect their chances of recovering. The third one is inflammation. This is related of what associated of what we're eating, no? Kung hilig natin kumain ng chicken, no? O yung halo-halo dyan sa South Cotabato, no? Alam ko masarap yung kumain ng halo-halo po dyan, no? Pero hinay-hinay din po sa mga matatamis po. Kasi ito may lead to taba. So fat cells can cause inflammation. So when you have many of them, as obese patients do, ito magkakaroon ng problema sa inyong immune response. Okay? So you have this major complication of COVID-19. We call it cytokine storm. So ano ba itong cytokine storm? Well, this is your immune system trying to kill not just the bad cells, but also the good cells that would lead to multiple organ damage that probably lead to death. So ayaw mo naman mangyari na parang nag-over-response, no, yung immune system nyo. No? So ito parang ano ba nangyayari dito sa mga yung flow na ito? So isipin niyo na lang po parang may digmaan, no? May isang sabihin natin ang Pilipinas, meron po siyang technology, old technology sabihin na natin na nag-sense na meron foreign intrusion sa ating bansa. So kung meron po mga foreign intrusion, yung ating mga sundalo ay papadala po, no, para lang patayin po ang mga foreign intrusions, no. So may digmaan na magyayari. Syempre sa isang digmaan, imposibleng wala pong casualties. So kunwari may mga casualties, syempre hindi maganda yung ating technology. So kung ating technology ay pumapalpak, ang pakiramdam naman ng ating ng technology na yun ay parang yung casualties ay meron na namang foreign intrusion. So magpapadala na naman siya ng mga sundalo para lang patayin po yun. Hanggang paulit-ulit po yan, hindi pala nagkakaroon ng miscommunication na po, nagiging out of control na po, na papatay na po niya po kung sino-sino na lang po. So kasama na dun yung good cells, or bad cells, hanggang makorrupt na po ang buong sistema. No? So if it becomes corrupted, it may possibly lead to death. So that is how a cytokine storm develops in a body. No? Of course, you don't want na meron pong digmaan na mangyari sa ating bansa. Okay? So here is a way for you to boost your immune system. So nutrition, no? First is healthy eating for stronger immunity. Second one is hydration. So you need to stay hydrated with water. Ang susunod na po ay yung physical activity. So as little as 20 minutes can suppress your immune system, no? And then the fourth component is healthy habits. So ito, not smoking, minding your stress, quality of sleep, and connectivity. Okay? So, ang kailangan pa rin ay well-balanced diet, no? This tend to be healthier with stronger immune system at lower the risk of chronic illnesses and infectious diseases. So you should eat the mga fresh and processed foods, no? So you will be getting the vitamins, the minerals, yung fiber for you to have regular bowel movement, protina para sa inyong muscles, no? So try nyo to have it as a healthier options instead of eating puro mga matataba at saka mga laman loob po, no? And then antioxidants, for you to get your to fight off the radicals, and avoid the sugar, fat, and salt, no, to significantly lower your risk of overweight, obesity, heart disease, stroke, diabetes, and some forms of cancer. Now, we have nutrition issues affecting COVID-19. Alam ko madami na kayo nag-search sa internet kung ano ba ang mga pwedeng pagkain, no? Na pwedeng mag-prevent ng viral infection, no? Itong COVID-19, mga iba inisip nila na yung alcohol na lang para lang patayin niya po yung pumasok lang po. Of course, hindi po yung totoo, no? So there's still no evidence that specific foods, mga supplements, mga probiotics, no, that would prevent or treat the viral infection. At alam ko meron din nag-take ng mga multivitamins like your vitamin C, your zinc supplements, but you need to remember na wag kayo masyado magre-rely too much on that, no? You need to get the right nutrients from your food, no? Coming from your food to support your immune system. And being infected, no, na hawa kayo, let's say, ng isang sakit, not just COVID-19, this would increase your body demand for energy and nutrients. Lalong-lalo na kung tumataas yung inyong temperatura, may lagnat kayo. Of course, your metabolism would go up. That means kailangan mo ng energy, no, to function properly, to fight the virus. So, kung wala kayong gana kumain, maybe that's already a signal that ito talaga pinapahirapan yung katawan. So you need to support your body para lang mabilis kayo mag-recover. Kung hinayaan nyo lang po yan, mas magtatagal po kayo mag-recover. Okay? And you need also the small particles of your protein. They call it the amino acids. These are the building blocks to produce essential antibodies. So, narinig nyo na po yung mga rapid antibody test po, no? Na ito ay yung mga IgM, IgG, these are antibodies that would fight the virus, no? So maganda rin po na you are also eating healthy po, no? Lalo na meron kayong substantial na mga prutas, gulay at mga protina, no? And other nutrients such as your vitamin A, your vitamin C, vitamin E, no? And minerals, zinc, copper, and selenium to help regulate their immune response. Please remember that supplements cannot substitute a healthy diet. Now, here are some factors that affect your immune response. So, not just your diet. Pwede rin po ang katawan, pwede magpababa ng stress, no? Yung age, yung alcohol, yung smoking, pwedeng bumaba po yan, no? But if you're eating a healthy lifestyle or eating a healthy meal, maganda yung physical activity nyo, fit kayo, naglalakad kayo madalas, so it may somehow optimize your immune response, no? So the World Health Organization has recommended you to eat fruits 2 cups per day. Nako, napakarami pong prutas po dyan sa Jensan, no? At saka napakamura pa po, no? Kumpara nyo po dito sa Luzon, ay naku, ang tataas po ng presyo. Ang pinya pa lang po dyan, masarap na po, galing Dole, no? O Dole. Mandarin orange, apple, banana, grapefruit, mamili po kayo, no? So take advantage of what you already have there, no? So kung hindi kayo sanay na magprutas, piliin nyo muna siguro mansanas, kalahating mansanas, o isang pirasong saging, no? You already meet the daily requirement for the day. So yan, no? Apple at banana. Susunod naman po, vegetables. So carrots, cabbage, squash, and turnips, mga green leafy vegetables, at least 2.5 cups per day po yan, no? So damihan nyo na po ang mga gulay kaysa sa inuuna nyo po ang mga karne na ilalagay nyo sa plato. Alam ko, hilig nyo po yung mga, yung manok po, no? Yung mga iba, hilig nila yung roasted, tapos ang sarap pa ng, nakalimutan ko na ano yung restaurant po na yun, pero masarap po yung manok at saka meron pong sausawan po. And then there are whole grains and starchy roots that you could also include as part of adding energy, no? Every day, no? Para meron kayong sustansya. Like your whole grain rice, ito yung mga red rice, yung mga brown rice, mataas ang fiber po nito kumpara po sa mga white rice. So madali po kayo mabusog. Kung hindi kaya sa budget, ang white rice sana po, pwede nyo lang sana itakal nyo na po sa inyong plato. Huwag niyo pong ihaharap ang isang buong rice cooker sa inyo, no? Kung hindi, uubusin niyo po yan, hindi niyo na lang alam, nakatatlo o apat na po kayong tasa pong kanin, no? At iwasan din po yung maglagay ng soy sauce sa inyong kanin na ginagawa niyo ng ulam, no? Ito ay nagpapataas ng blood pressure niyo po. So iwasan niyo po yan, ha? Madami pong gumagawa po nito, okay? Next would be wheat bread. So wheat bread sana ang pipiliin kaysa sa mga bread na may fillings like yung Spanish bread, yung mga mamon, ensaymada. Pumili na lang kayo ng tasty or wheat bread pa po mas maganda. Tapos kayo maglalagay ng inyong palaman. Next would be the oatmeal, no? Kung pwedeng oatmeal kaysa sa mga champurado. May instant oatmeal, no? Piliin yung original kaysa sa mga flavor. Kung meron kayong maraming sweet potato o kamote, ilagan nyo na po yan, no? Better pa yan kaysa gawin yung kamote Q. Kasi ang kamote Q, matamis na nga, mataas pa sa calories o nagpapataba pa po yan. Okay? At alam ko, meron po mga ibang lugar po dyan na kailangan pong, hirap po no, bumili sa KCC o iba pupunta pa sa ibang lugar sa para lang makabili, no? At saka yung time, no? Yung merong curfew. Kung pwede, pumili na kayo mga long-lasting foods na ito yung mga dried fruits, nuts, and seeds. Kung pumili kayo ng mga unsalted at unsweetened, no? Ito, iwasan nyo din yung mga adobong mani, no? Next, yung mga canned vegetables. Kung hindi kayo makapunta sa inyong mga palengke. Pero kung kaya na naman bumili sa palengke, pumili na kayo ng mga fresh produce like your mushrooms, spinach, peas, tomatoes, and green beans, no? Pero kung wala lang, canned vegetables lang po, no? As an alternative. Kaysa puro processed meat, kaysa puro tocino, longganisa, tapa, ham, no? Iwasan nyo na rin po mga yan. Next, the dried and canned pulses would be the beans, the chickpeas, lentils, yung mga tokwa, no? Meron pong mga protina din po ito, hindi lang po ang mga karne. Okay? And canned fish, like your canned tuna, sardines, and other fish, o meron na po kayo yan, no? Pero ano ba pipiliin nyo? Pumili na kayo ng fresh po sana o yung mga fish canned in water. Kaysa sa mga nakalagay sa oil, kaysa nakalagay sa brine or fried na sardines, no? Pumili kayo ng mga fish canned in water. Okay? And for you to boost your immune system, tumulong sa inyong mental health, kung nasi-stress po, ay kumain kayo ng mga citrus fruits like your oranges, calamansi, no? Pwedeng mga lemon, pwedeng mga grapefruit, no? Suha, ang daming suha pa. Ewan ko kung panahon na po suha, pero nakatikim ata ako ng time ng gantong panahon. Garlic at onion, green leafy vegetables, your bok choy, malunggay, sayote, mataas ang fiber niyan, potassium din po. Yung berries like your tomatoes at eggplant. Ito, health trivia. Ang tomato, kung niluto nyo ng tama, it would enhance yung lycopene content. So, it is good for your heart. So, naririnig nyo sa ketchup po yan ng mga commercials na itong ketchup high in lycopene content for your heart. Actually, because it's cooked properly, kaya mataas yung lycopene content. Unlike yung mga fresh na mga vegetables, citrus fruits, mas gugustuhin natin mga fresh ang pagkakain para ma-maintain yung mga enough vitamins and minerals. Pero itong tomato, for you to get the lycopene, kailangan yung lutuin po na maayos po. So, here's another mineral na kailangan din po to support your immune system, and studies have shown that it could lessen your common cold o yung sipon, no? Pero sa COVID-19, wala pa rin pong ebidensya na makakatulong po ito to recover or prevent, no? But as a part of supporting your immune system, kailangan nyo isama to. Pwede mga seafoods, yung mga oyster, kung medyo may kamahalan, pwede mushroom, yung sitaw, at itlog. Sa itlog, isang itlog lang sa isang araw po. Huwag dadami ng 3 kasi tataas inyong mga cholesterol po. Okay? Susunod naman po yung vitamins. So, vitamin D. So, vitamin D, Akala natin bone health lang po ito, pero studies have shown that vitamin D may affect different components of your immune system and its response to infection. So get adequate vitamin D from the food like yung salmon, sardinas. O yan, ang dami nyo na palang option, no? Pwedeng itlog o mushroom. Pero kung wala naman masyadong option na ganyan, pwedeng sun exposure, magpa-araw kayo. Like 15 minutes lang po. Mga before 9 a.m., mga umaga, at saka alas 4 pasado po. Okay? And kung wala pa rin pong ganito, lalo sa mga office space, sa mga nag-work sa offices, pwede naman vitamin D supplement, no? 800 international units once a day. Okay? And when you're eating healthy foods, bawasan nyo naman po yung mga, alam nyo na po, mga unhealthy ones. These are the inflammatory foods, the processed, refined, and artificial foods like your salty and fried, yung french fries, yung chips, yung soda, ito may red meat, processed meat, milk tea, no? Bawasan nyo din po yan yung mga cookies, pastries, no? Please bawas nyo po yan. Okay? Because when you limit the inflammatory foods, you will be reducing the levels of inflammation in your body. No? Para hindi siya mag-overreact, hindi kayo ma-feel din na hindi rin kayo maging sakitin. No? So bawasan nyo rin po yan. Kung nararamdaman nyo may mga allergies kayo, sumasakit ang ulo nyo, tingnan nyo baka meron pa kung kayo nakain na mga matataas na preservative o chemicals po. Okay? Ang susunod naman po ay hydration. So sa hydration, may apat po na functions ng hydration o yung tubig. So first would be, it is a transporter of nutrients and compounds in the blood. So ano po ba ang mga vitamins po na to? Vitamin C, vitamin B complex. So kung kulang iniinom ng tubig, syempre no, hindi siya ma-absorb ng tama because kailangan niya ng tubig po para ma-absorb ang vitamin C, yung mga iniinom na ascorbic acid. So, pag iinom kayo ng mga supplements din po, uminom din kayo ng 1 glass of water. Okay? Next would be, it controls your body temperature. Sa mga may init ang ulo, baka eto, kulang lang pala kayo sa tubig. So, magtabi na kayo ng baso o mga container nyo sa tabi nyo po para hindi mainit ang ulo. No? Next, it is a natural detoxifier. It gets rid of your waste. So wag kayo masyado pong bibili ng mga produkto na pangpawala ng o pang detoxify. Actually, ang tubig pa lang po ay isang magandang detoxifier. It also protects and cushions your joints lalo na sa mga matatanda. So ang recommendation is to drink 8 to 10 cups of water every day. Ang tubig pa rin ang best choice. Pero you could consume other drinks, like yung mga caffeine, and avoid sweetened fruit juices, mga concentrates and syrups. Please limit your intake of your energy drinks, no? Mga iba no, nararamdaman nila kumakabog ang dibdib. Kung naramdaman niyo na po yun, tumataas na po yung caffeine levels niyo, no? Hindi rin po maganda na may palpitation, no, sa inyong mga puso. Kung nagtuloy-tuloy po yun, make isang condition po na hindi rin maganda mangyari sa inyong puso. So please avoid that kind of feeling, no? So number 1 pa rin is tubig. Pwede kayo gumawa ng mga fruit and vegetable juices. Yung mga nag-shake, please bawasan nyo naman po yung mga condensed at evap po, no? Kung pwede natural sana po, no, na water na lang po o maglagay ng konting honey po. Tsaka mas maganda kaysa sa milk tea. Ito, kape. Kung kape, brewed coffee sana, o yung mga kape na may instant coffee na separate yung creamer, separate din yung asukal. So iwasan po ang mga 3-in-1 coffee kasi yung 3-in-1 coffee contains 6 to 8 teaspoons of your sugar, no? So isang reason din po nagpapatas ng inflammation in your body, nagpapatas po ng inyong asukal, no? At isa rin nagpapatas ng timbang niyo po. Okay? Ang pangatlo pong component ng active care health is physical activity. So, ang physical activity, not necessarily mag-exercise, pupunta kayo sa gym para lang maging fit. At actually, maski naglalakad kayo, gawain na sa inyong mga opisina o sa inyong trabaho, yung mga nagkakarga, that's already physical activity po, no? Pero syempre hina-hina din po sa pagkain ng maraming kanin po, no? Wag masyado pong maraming kanin po. I-control nyo din po. At syempre sa inyong mga sausawan, please bawasan nyo po, itabi nyo po, ilagay nyo sa isang sausawan po o saucer po, no? Hindi po ang soy sauce para sa inyong plato, no? So bawasan nyo po yung mga ganyang practice po na nilalagay, binubudbud po dun sa inyong mga kanin. Iba naglalagay pa ng seasoning, no? Nor seasoning sa kanilang kanin. Nako, dun tumataas din yung inyong blood pressure levels po. So iwasan din po yan, no? So the physical activity, aim nyo po, no? 30 minutes in a day, 5 times in a week. Ang example ng magandang physical activity ay walking from mga 20 to 30 minutes. Pwede rin naman po kung naglalakad na kayo papunta sa inyong trabaho, tapos mag-jeep, no? Pwede po yun, or konting lakad, no? It could take us 30 minutes kung ginagawa nyo na po. At your physical activity could help you in your mental and emotional health. So iba po nandyan sa mga work area, sa opisina, kung pwede, lumabas din po kayo, no? Enjoy nyo din po yung magandang view, no? Baka sa Lake Cebu, punta lang kayo po dun, baka po papayagan, no? I have developed this SWOT, or this is for people working from home. I call it the SWOT. So S, stand up, ideally every 30 minutes. Lalong-lalo naman sa mga gumagamit ng mga laptops, lagi nakaupo. So stand up every 30 minutes, no? And then stretch, no? Para lang matanggal lang yung inyong iniisip na stress. W is to walk around and walk on the spot. Kung meron kayong mga tawag, meron kayong email, meron din kayong nag-hello si Mrs., nag-hello yung boyfriend, o tayo na lang muna kayo para may pangpadagdag ng physical activity. And then O, online exercises to take advantage of from your YouTube, no? And T, take short breaks like dancing, playing with your children, tapos paglinis sa inyong mga bahay, kwarto, isa na pong physical activity po yan. Okay? So meron pong mga examples na pwede niyong gawin sa YouTube, like si Chloe Ting. Sa mga millennials po dyan, pwedeng itong gamitin po, o sundan, no? Baka maging mas gumanda yung inyong katawan. Susunod ito, sa mga sawang-sawa sa Zumba, ito, pwede nyo sundan, yung Walk at Home by Leslie Sansone. This one is a fast and brisk 10-minute walking. Madali lang po siyang sundan. Mga 10 minutes lang po. Tapos kung nasanay na kayo, doon nyo na itaas po yung physical activity nyo po. So you could take a picture of this one and then scan the QR code. Okay? And here are some home-based exercises that you could do at home. Lalong-lalo na yung mga biglang nag-quarantine, no? Siyempre kung wala namang kayong ginagawa, or maybe that person is asymptomatic, you engage also with physical activity. You could try this knee to elbow. So tataas niyo inyong kanan na yung leg, and then touch nyo dun sa inyong elbow sa left side. Just do it on the other side and perform this in 1 to 2 minutes and rest for 30 to 60 seconds. Tapos pwede na naman itaas up to 5 times po. Susunod naman po yung squats. Kung pakiramdam nyo, lumalaki na yung tiyan nyo po, no? Para to boost lang yung metabolism nyo agad. Squats po, you could perform this one mga 10 to 15 times and rest for 30 to 60 seconds. And repeat up to 5 times. Pwede kayong gumamit ng upuan para to guide you kung gaano kababa ang pagbaba nyo po yung gantong pwesto, no? Another would be the side knee lift. So ito, tatasin yung right leg and then touching it with your right elbow. Tapos do it on the other side. So pareho din, no? You could repeat up to 5 times if you want. So this one targets your lower extremity, no? So more on the movement pa rin sa baba po yan. Ito ay magandang exercise for both physical and mental health. So I call it the modified chest opener. So what are you going to do with this one? You're going to put your hands behind your back. Maski nakaupo po kayo, pwede nyo gawin behind your back, and then stretch it, no? pwedeng pababa, pwedeng palikod, no? Tapos mararamdaman nyo yung shoulders nyo, yung arms, and then your back. Medyo if you feel nyo may tension po ng muscles, no? And then once you're doing that, you close your eyes and then do some deep breathing. So kung deep breathing po, you have to uh, inhale it through your nose and then exhale it through your mouth, no? Parang pumipito po kayo yung pakiramdam and then slowly lang po, okay? So i-repeat nyo for 3 to 5 times po. Okay? So that's good for your physical and your mental health po. Sa mga malalaki ang mga braso, no? Paano ba papalitin po yan? So, pwede nyo gawin po itong chair dips. So, you need a chair. Dapat stable po yan. Hindi umaalog-alog. Baka masira niyo upuan, lalo na kung mabigat kayo, no? Perform this exercise 10 to 15 times and repeat up to 5 times if you want, no? Next, kung medyo masakit ang likod, o parang biglaan sumakit lang po pero kung yung mga constant po na mga back pains, you need to get the right or get consult with a doctor. They'll give you the right treatment po. But for now, for general population, biglang sumakit lang po, you need to have this kind of exercise, the back extension. So kailangan nyo lang clean yung floor nyo. You'll be lifting or your shoulder, your head, your neck, and touching your ears with your fingertips. Okay, so perform this exercise 10 to 15 times and repeat up to 5 times if you want. Okay, so ang huling component ay healthy habits. So para lang magtuloy-tuloy po yan, no? So, syempre, mataas ang stress level mo, anong gagawin mo? Mapapakain ka, hindi ka na mag-exercise, no? So, make sure na if you have already some tasks, isulat nyo na po yan. Tapos kung masyadong mabigat yung task na yan, pwede nyo pong chop-chopin po yan. Tapos gawin nyo muna kung anong kaya nyo munang gawin para hindi kayo masyado ma-stress, no? Next, avoid smoking and vaping because you know this is very toxic to your lungs and you know that this virus enters primarily to your lungs. So, wag na po kayo magpadagdag ng stress at saka ng severity sa ganitong mga conditions, lalo na sa mga naninigarilyo, no? Third would be quality of sleep. Target 6 to 8 hours of sleep sana po, no? Kung medyo hirap po matulog o parang umuurong or maybe umaabante yung kanilang oras, madaling araw na sila nakakatulog, you have to wake up early or wake up with using an alarm clock, no? And get support from your family and friends, no? Could be kung doon sa household nyo, makipagkwentuhan lang kayo kung ano ba pwede kong gawin para mas tapos na to, no? Yung mga problemang ganito o baka meron pala siyang solusyon, no? So you have to get support from them and siguro mga TikTok po diyan, if you're happy entertaining other people, you know that positive emotions are shown to improve immunity. So don't be shy, no? Baka may talent kayo. Next, this is a bonus slide. So sa mga may problema, yung mga very kinakabahan, laging stress, no? So avoid watching, reading, and listening to news about COVID-19. Kasama na dito yung mga negative news, no? So mas lalo kayo masistress po niyan. O kung medyo inggitin kayo, i-avoid niyo yung social media muna. Kasi baka mainggit kayo, oh, bakit siya nakapunta sa ganito? Bakit siya nakakain ng ganito, ako hindi, no? Mas lalo kayo nasi-stress ng ganun, no? So avoid nyo po muna 'yan. But if you need to get information for work related, no? Get information from for COVID-19 once or 2 times in a day. And get it from trusted sources from your local or your LGU sa Gensan, sa South Cotabato, Sultan Kudarat, no? O kung taga Davao kayo, get it from the Facebook page po nila, no? And then addition is to limit the caffeinated drinks, yung coffee, tea, milk tea, energy drinks, and alcohol, no? So bawasan niyo po yan. Alam ko Oktoberfest, gustong-gusto niyo na pong uminom, pero make sure that you have to control your urge. Kung pwede sana mga less than 3 glasses or beers, kung pwede lang po. And iwasan din po yung mga practice na kunwari inom kayo ng fundador, no, emperador, tapos isa lang po ang glass. Siyempre maghahawa-hawaan po kayo, no, lalo na kung di nyo alam isang tao po nakatakas. Ngayon pala siya may COVID-19. O di naghawa-hawaan na lahat, no? And baka ma-penalty pa kayo, ma-violate niyo pa yung ating bayanihan law, no, or yung laws nyo dun sa inyong area. So avoid that one. And if you limit your alcohol, you limit also the caffeinated drinks, you would somehow help you in your mental health. Okay. So in summary, I was able to discuss the fruits, yung mga nutrition, fruits, vegetables, whole grain, and starchy roots. Tapos magdagdag kayo ng anti-inflammatory foods like your citrus, berries, green leafy vegetables. Pwede naman kayo mag-vitamin C, vitamin D, tas zinc, no? Pangpadagdag po yan. And then yung hydration ng 8 to 10 glasses in a day, huwag kakalimutan po. Physical activity, aim nyo muna 20 minutes. Sa mga mahigit na po, like 30, 40 minutes, tuloy nyo po yan. No? Basta wag nyo na pong sasaktan yung inyong mga muscles o inyong sarili po. Okay? Make sure when you're doing physical activity, nag-enjoy din po kayo. Okay? And the last part is healthy habits. So, minding your stress, you quit smoking, quality of sleep, and connect with your family and your friends. So if you like my presentation, you could like my Facebook page at Dr. Jen Dipasupil. All right. So thank you for your attention. I give the floor back to Irvin.
Okay, thank you so much, Doc Paolo. Merong mga questions dito, Doc. Isa-isahin ko lang. Okay, regarding sa vitamins, especially sa panahon ngayon ng COVID, ano yung mga vitamins na ma-recommend ninyo na ma-consider na talagang makakatulong to increase or to boost the immune system?
Okay. So nasabi ko kanina yung vitamin C, that would be 500 milligrams lang po muna once a day. Pero syempre, no, sinabi ko, kailangan muna you get it from your fruits, no? Kung madami namang prutas po kayo dyan, you could already get it from that. Next would be the zinc, mga at least 15 milligrams po na zinc. Next is vitamin D or dog, no? So dagdagan niyo po yung vitamin D. So yun yung mga tatlo po na kailangan niyo po sa inyong to boost your immune system. Others would be your vitamin A, your vitamin E, pwede po rin yan. Pero yung tatlo na importante sana po to boost your immune system.
Right. Meron bang Doc? Meron bang overdose ang vitamins?
Yes po, meron po. Lalo na yung mga nagtitake ng mga vitamin C na napakataas, it may cause na magkaroon ng stones sa inyong katawan, no? Hindi rin po maganda yan. Ganun din po sa zinc, no? Kung sumobra din po yan, kaya na pong i-block po ang ibang mga minerals at saka yung metabolism if sumosobra ang zinc. Okay? So, wag masyadong praning na uminom ng mga vitamins po, no? At saka, ang kailangan nyo rin gawin, no? Ito yung mga nakakalimutan ng iba. If you're going to take multivitamins, please naman po, basahin nyo naman po kung ano yung nandun sa likod, no? Baka may vitamin C na, may zinc po yan. May iba kasi bibili ng multivitamins. Nakita niya, uy, bumili siya, no? Multivitamins, gumagana. Pero ako, umiinom na ako ng vitamin C. So, inom din ako ng vitamin C. Pero, hindi niya alam, may vitamin C na pala yung multivitamins. Okay? So, tingnan niyo din yung mga labels niyo po, ha? Yung sa mga supplement bottles po. Baka meron na po mga dumodoble na po yung tinitake niyo po dyan. Okay?
Okay, thank you, Doc. Some more questions? Okay, meron dito, Doc, up to how many milligram of vitamin C in a day?
Okay. In general, adult na walang sakit, we tell them to take it 500 milligrams lang po, no? In our body, yung daily value lang po, it's 120 milligrams lang po, no? Per day. So yung 380 tinatapon ng inyong katawan po yan, no? So if you're taking a lot of vitamin C, baka that's too much, no? You're already overloading your kidneys po. Unless your doctor prescribed to give you 1,000 milligrams of vitamin C, then follow what that doctor said. No? Baka meron pong mga kondisyon o baka meron pong naisip po siya bakit you have to take that one. And yes, vitamin C is water soluble. No? So kanina, no, sinabi ko, no, dun sa 4 functions po ng hydration, ang vitamin C is water soluble. Ibig sabihin, you need to drink water po. Because kung kulang ka sa tubig, it won't be absorbed effectively. Unlike yung mga ibang vitamins na vitamin A, vitamin D, vitamin E, and vitamin K, o ADEK na tinatawag po natin, these are fat soluble. So kung kulang naman sa taba, no, parang masyado naman yung dinideprive ng konting taba, no, it may not be able to absorb naman yung mga 4 vitamins na yun. So that's something that you should also know, no, na dapat well balanced diet pa rin ang kakainin.
All right. There's a follow-up question on that, Doc. What is the best time to take vitamin C while taking iron folic plus?
Oh, what's the other one?
What is the best time
Iron.
to take
Iron.
iron folic plus?
Iron folic plus, preferably in the morning po sana yan, preferably. Okay? And then there are times that it may alter or interact if you're going to have it with meals. Pero kung sinabi ng doktor nyo na kailangan nyo i-take it before or after the meal, sundan nyo po sila. Okay? Next, meron po mga vitamin C preparations po, no? Na nakikita nyo ngayon sa mga ibang mga butika po. May ascorbic acid, may sodium ascorbate, no? So, effective ba yung isa kaysa sa isa? Mas maganda ba yun? Well, actually, pareho din po siya ng effect. However, ang ascorbic acid from the word acid, no? Pwede po siyang magpataas ng asido sa inyong stomach. Kaya kung hindi kayo kumain ng, let's say, ng meal, no? Uminom na agad kayo ng vitamin C, ramdam nyo na medyo sasakit ang inyong tiyan, no? Dahil sa pagtaas ng acid. Compared with sodium ascorbate, wala siyang acid po. Kaya maski hindi kayo kakain ng o hindi kayo kumain ng almusal po muna, ininom nyo lang po agad yung sodium ascorbate na yun, that would be okay.
Okay, Doc, thank you. Another question. Is virgin coconut oil a good way to boost immunity against COVID-19?
Okay, good question po yan. Well, according to the FNRI DOSD, they're still on the process of getting all the results, but it's promising yung resulta po, no? But wala pang endorsement po yan sa Department of Health and even the medical societies to take or to prescribe virgin coconut oil. So we're still waiting for the latest updates from them. Okay, so we'll see now. We'll see.
Okay. Then another question. Some say that taking hydroxychloroquine will help when exposed to a COVID positive person.
Okay. Well, hindi po namin nire-recommenda that you're going to self-medicate, especially hydroxychloroquine po, no? You still need to consult a doctor. You still need to go for the right protocols po, no? Lalong-lalo na kung may exposure po kayo. Okay? So do not self-medicate, do not self-manage yourself. Especially this is a national security. We want you to report it to your local authorities. Huwag kayong matatakot because the government will be helping you. Okay, in terms of they may cover you the expenses, lalo na yung COVID-19 testing po, no? So don't be afraid, no? Kung lalong tinago niyo po yan, mas lalo pong dadami ang kaso, no? So just follow or seek consultation with a doctor before you taking any medications and even supplements po. All right?
Okay, Doc. Another question, Doc. Regarding doon sa patients with comorbidity, let's say na-expose sila sa virus, compared doon sa healthy person na na-expose sa virus, ilang days kaya pwedeng mag-manifest yung symptoms?
Okay. Well, it varies, pero based on the studies, the manifestation based on the exposure would be 1 to 3 days po. Okay? So that is the lead, yung parang days po when you're going to have the symptoms. And for the incubation period, ito po yung time na pwede rin po kayo maghawa, no? So 14 days pa rin po yan, no? Strictly pa rin po that we have to follow then the quarantine of 14 days po. So, mga may exposure or yung mga sa tingin nyo may positive po, please follow po the 14-day quarantine. Okay?
Yung mga pag-take po ng vitamins, Doc, meron bang difference in terms of dosage? Yung normal lang na health, yung normal na walang mga existing health conditions versus doon sa may mga comorbidity. Meron bang number of additional dosage for those with comorbidity?
Well, it depends on the clinical decision of a doctor. But some of the doctors, if they think na meron pong mga viral infection or bacterial infection, the vitamin C may go as high as 1,500 milligrams. Some of the zinc would go or magdodoble po yan, no? That may include also the vitamin D, vitamin B complex, depending on the clinical judgment and the laboratory results. So just don't self-medicate, no? Please listen to your doctor. If you have a physician in your facility, magpatingin na po kayo, and don't forget to disclose din kung ano yung mga supplements na iniinom nyo. Maski collagen po yan, drinks na yan, sabihin nyo din po, no? Baka meron pong mga sanhi din po na baka nagkakaroon kayo ng mga allergies, headache. It could be because of what you're already eating or drinking po. Okay?
Okay. Now, regarding naman po dun sa vaccine po, Doc, against COVID-19, meron ba tayong latest update about kung how long pa ba yung magiging waiting period natin? Any idea po, Doc?
Okay. Based on the experts, they are waiting sana, no? The earliest would be the year end or before itong New Year na meron na po mga resulta. Meron po kasing 4 phases po yan, no? Para lang maging approved po yan as vaccine or ma-approve as a medication. Yung phase 1 is to know kung safe po ba yung gamot. Kung safe po yan, at saka yung dosage po, safe po yan, yung tamang milligrams, doon na po papasok na siya o papasado, pupunta na siya sa phase 2. So sa phase 2, ang gagawin naman doon po ng mga is to know kung gaano ka safe talaga to. So aalamin na kung ano mga simptomas na, no? Kung may negative or what. Kung hindi po may mga negative simptomas po, syempre hindi na po magpo-proceed po yan, no? As yung sa phase 3. So sa phase 3, effectiveness naman ang check po niya. Kung talagang may immune na po sa ating katawan o hindi po. And then the phase 4, i-check na po nila kung talagang in the limited setting or limited ni mga participants kung okay po ba yung ating yung effectiveness at safety po ng gamot or yung vaccine po na yon. So according to the phase 4, parang nasa 6 na po, no? Bago po siya maging approved globally po. Okay?
Okay. Some more questions? Baka mayroon pa tayong ibang questions dyan. You can also use your microphone if hindi kayo comfortable na i-type yung question sa chat box natin. Follow-up question regarding the virgin coconut oil, Doc. What dosage of virgin coconut oil can be considered healthy and good for the body?
Okay. Well, we actually don't prescribe po. We don't really prescribe mga virgin coconut oil pa po. But if you wanted to have like mga 1 teaspoon lang po yan. To give you an idea, no, ang coconut oil, kung ang preparation po, hindi po siya liquid, parang namumuo po yan. This is saturated fat po siya, no? So, hinay-hinay lang po ng pag-take din po yan. Huwag kayong magti-take ng mga ilang tablespoons po yan kasi taba din po yan, no? So, baka tumaas din yung inyong cholesterol po at it may lead also to fatty liver diseases and it even affect your heart, no? So, controlled amounts, 1 to 2 teaspoons lang po in a day. Okay?
Mm-hmm. Doc, regarding sa mga vitamins, what's the difference between the generic na mga vitamins versus doon sa mga branded? May difference ba?
Well, in terms of the chemical structure or preparations, halos pare-pareho lang po yan. Pero naiiba rin po yan sa ano po yan, no? Sa ibang mga chemicals na nilalagay or preservatives po. So, kanya-kanya din po yan. If you are going to check din po yung, let's say, you tried a brand na isang brand na drug, there are times na parang, uy, okay to sa akin, no? Yung ibang brand, ibang generic naman po, it may have the same effect, pero minsan, it could lead to na parang matagal ma-eliminate po yung drug po na yun o kundi matagal po siya maging effective po. So there are different mechanisms and pharmacokinetics din po that plays a role din kung with the change in chemical structures po. But generally po, no, if a doctor prescribe a medication with kunwari paracetamol, yung effect pa rin na gusto namin ay yun po. So um, there's no significant difference of other brands po. Okay?
All right. Ito, another question. Is drinking warm green tea frequently a good alternative to water? Or is there a limit to what green tea you have to drink per day?
Okay. Drinking warm green tea is good, no? Pero water pa rin is the best choice. Here's a limit sana, no? The green tea, meron pong caffeine din yan. It may increase your metabolism din po. If you took green tea sa gabi po, no? Siyempre tataas yung metabolism nyo, medyo alert din kayo. So, it may delay your sleep, no? And there are times that if you have high levels of caffeine, it may also would affect your quality of sleep. Ganun din sa alcohol po, no? So, kung konti po or parang naparami ang alcohol nyo, syempre unang pakiramdam nyo is parang antok na antok kayo. Pero when you're already sleeping, hindi ganun kaganda yung inyong tulog.
Okay. Thank you, Doc. Now, regarding dun sa Doc, regarding dun sa COVID, let's say the person exposed umabot na ng 14 days yung kanyang quarantine period. And negative yung, when we say negative, walang symptoms. Would you require na mag-continue pa siya ng another number of days to complete yung 21 days na quarantine period? Kasi dito sa Jensen, 21 days yung aming total quarantine period.
Ah,
Yeah.
Oh, okay. Well, based on the international recommendations, even the Department of Health recommendation is to have 14-day quarantine. But if there is like a higher risk in your area, lalo sa Gensan, kung limited po yung mga testing, limited din po yung mga facilities and yung mga healthcare, yung human resources, these are ways for them to reduce the active cases, to also reduce din po yung burden po in one community. So if that is the case, then follow what the government has imposed. So 21 days kung ano. But you also have to get in touch then with yung mga contact tracers din po, no? Na if you are feeling better, baka okay na. Or if you wanted, there are times, ideally po ang setup po, if you tested positive with a RT-PCR, the mga 14 days, you have to get another RT-PCR test po to show or to know kung positive or negative pa rin po yan. Okay? So that's the ideal way for us to know if you are yung course of COVID-19 of a person.
Mhm. What if, Doc, during that period, yung 14 days na complete na, and then wala naman pong symptoms na nag-manifest, kailangan pa bang i-require talaga siya ng RT-PCR?
Sorry, say it again.
Kasi after 14 days, wala namang symptoms na lumabas, i-require pa ba natin siya ng RT-PCR?
Well, kung nag-test siyang positive from the RT-PCR, required pa rin po yun na 14 days po. There are some strains po ng COVID-19 or that coronavirus na wala pong masyadong minamanifest pero positive po siya. So, yun yung mga silent carriers na pwede niyo pong ipagkalat po yun. Pumunta sa mall, ipagkalat niya sa mga anak niya, sa mga asawa, lalong-lalo na kung nag-share pa rin sila ng mga personal items. So, that's really hard, no? It's really hard na to control kung ganun po ang mga silent killers po. Okay? Ay, silent carriers po. So, follow pa rin po the 14-day quarantine. That is really the ideal days for you to lessen also the burden of your local community.
All right. Yung mga silent carriers na na-mention mo, Doc, is there a chance na mag-stick pa rin yung virus sa katawan nila after 14 days or more than 14 days? And then without any symptoms?
Well, normally that's a good question. Normally, that your body would be trying to defend itself. So magkakaroon ng inflammation, di ba? It's part of yung fever, your cough, and then yung nararamdaman, nagkakaroon ng inflammation. The inflammation is one way for you to defend yourself from the disease, no? And nagkakaroon ng viral shedding ang tinatawag. So, tinatanggal niya na po yung virus po. Normally, that's the case. Now, after 14 days, syempre mawawala po yan. And then the antibodies would still be there, no, very active. But if there would be no exposure, parang nawawala naman na po yung ganong yung infection, syempre baka mawala din yung antibodies po na yun. But if there's a person na parang hindi po siya positive po siya, kinausap kayo without a mask, then there's a higher risk of getting another reinfection ang tinatawag po yun. So, possible pa rin po na may reinfection po yun.
All right. Okay. Thank you, Doc. Last question, Doc. Okay lang? Is there a chance na magkaroon ng infection ulit yung naka-recover na sa COVID-19?
Yes po, possible pa rin po yun. So, ang tinatawag po dun ay reinfection. Lalo na kung hindi po siya, hindi siya nagpo-follow ng wearing of the mask, hindi niya kino-cover yung nose and mouth. Susunod po, yung social distancing, very important po yun, or yung 1 meter distance. avoiding the crowded places, at saka hand washing, no? Hand washing po, kailangan pa rin yun. At least 20 seconds pa rin po yun. You need to rub your hands po para lang matanggal yung germs po. Maski yung mga libag po nyo, kailangan nyo matanggal po yan. Okay? So, huwag kakalimutan pa rin po mag-wash yung hands. Sa mga lalaki, alam ko ang ginagawa nyo kung umiihi po kayo. Pagkaihi, kukuha ng tubig, sprinkle lang, tapos na, no? Well, of course, you need to wash your hands. You need to rub it, okay? Kung wala pong soap, kailangan is alcohol gel or yung alcohol po. Kuha po muna kayo kung wala. Pero pagdating nyo sa bahay, you need to wash your hands, okay?
All right, so I think that's it. I think na-answer lahat ng question, and thank you so much, Dr. Paolo, for your time. And enlighten kami with all your sharings and all the information na share po ninyo, Doc. So on behalf of RD Corporation and RD Group, we would like to thank you, and of course MaxiCare, for partnering with us with this webinar. Okay, and I would like to acknowledge also Ma'am Dawn Kimberly Ancheta of MaxiCare for joining our webinar this afternoon. So guys, I'll see you again next webinar. Okay, that will be next week. We have another webinar in partnership with MaxiCare. Again, Doc, thank you so much and have a nice day. Hi, goodbye everyone, and stay safe. Bye-bye.
Bye. Thank you, Kim. Thank you, MaxiCare. Thank you, Irvin. And
Thank you, Doc.
ingat po sa lahat. Okay? All right. Bye-bye po.
Bye-bye.